The Osteobone repair material is a kind of safe and effective artificial bone product boasting of three functional advantages: osteoinduction, bionic three-dimensional structure, and best matching rate between material degradation and new bone growth. Osteobone is indicated for the repair treatment of defective bone tissue in non-weight-bearing parts of the human body, such as orthopedic trauma, spinal fusion, maxillofacial surgery. When osteobone is filled into the defective bone area, be sure there's some blood in it. Also, the gap between osteobone granules needs to be filled by grinded osteobone material. After osteobone granules are completely infiltrated by bone cavity blood, it is required to be covered by periosteum or artificial collagen membrane. As growth sources, the bone stem cells, undifferentiated mesenchymal cells, etc., in the bone cavity blood grow within the osteobone bracket as a kind of porous, non-crystalline material composed of the elements of silicone, calcium, phosphorus, oxygen, magnesium, and sodium. Osteobone has a similar composition ratio to that of new bone. It will degrade in time after absorbing bone cavity blood, which finally becomes a part of the new bone tissue. Due to the matching speed between osteobone degradation and new bone growth, it can provide enough space for the growth of bone tissue and at the same time completely replace the defective bone area with new bone. The new bone tissue is integrated with the original broken part before finally getting up to pace with the physical renewal of human bone tissue. Let's see why osteobone can quickly repair human bone. It has four basic conditions. Firstly, the best growing space for bone cells. Secondly, the blood vessels required for bone cell growth. Thirdly, the brackets formed by intercommunicating channels. Finally, the metabolite excretion channels.